Hi, everyone, and welcome to another episode of Help Nobody Told Me. I'm Shannon Johnson, and I'm a realtor here in the Chicagoland area on the North Shore. And I have my business partner and friend and co-host, Jasmine Shapiro, today.
Hello, and I am super excited because we have Leslie Kischer with us, and I met Leslie in a fundraising group that we are in, and so excited Women United, and I'm so glad that you're here because
Glad to be here.
you fall into this category of Help Nobody Told Me. So just to introduce Leslie a little bit, you are the president and owner of Assured Healthcare Staffing and Assured Care at Home, and you work with families every day to help them navigate in-home care, support for individuals living with disabilities, and how to plan ahead so decisions aren't made in the middle of a crisis, which is exactly what we're about.
Right.
So tell us about your company, and I know your mom started it, so give us a little background.
Yeah, well, my mom is an RN, and she is an amazing person. When she left hands-on nursing, she got into healthcare staffing, and she worked with Manpower International, and then she left to start her own business. And at some point down the line, Manpower said, we're going to get out of healthcare staffing. It's a little bit tricky, and she ended up buying that book of business from them. So that was back in '07, and in 2018, I started working for Assured Healthcare Staffing after really resisting because I don't have a healthcare background. And 2021, I bought the company because I really love the work that we do. It didn't take much time before.
So you didn't need to have the nursing background to be able to run a company?
No.
You didn't know you were going to be passionate about it, sounds like.
I didn't.
Okay.
Healthcare is, in this country and in many countries, is very complicated and oftentimes isn't done that well.
Right. It's confusing.
Amen.
Yeah, amen. And staffing, if you know anything about it, has a reputation for being very difficult as well. So you combine those two businesses, and it seems like I just didn't think that I wanted to have that much chaos in my life.
And here you are.
And here I am. Here I am, the proud owner.
Well, do you think that part of that was watching your mom in the field? Is that part of what made you passionate about it, or?
I think so. Well, my mom is so knowledgeable and so caring, but nurses as moms are also very much walk it off, So there's a dichotomy, but I did see her do home health nursing, and she did school nursing, and she was a hospital nurse as well. So I saw her through different parts of her career, but when she became an entrepreneur, a businesswoman, it's the combination of those two passions of hers that really, that was what made me feel like, all right, I'd like to see what this is all about.
So you started working there.
Yeah.
And then what surprised you the most once you got immersed into all of this?
There were a lot of surprises. Staffing, when I went in there in 2018, a lot of the business was still done by fax, like time cards and fax. Yeah. And everybody by 2018 had iPhones or Androids. And so I walked in and
Did you say fax?
Fax, fax. A facsimile machine.
In 2018.
We have a 98-year-old client who has a facsimile machine. Yes. And so for me it was like, what? We could change the world if we automated some of these things.
If we're doing well now.
Yes. From a business standpoint, it's like there's so much opportunity to take all the busy work out of it.
Gosh, yes.
And then we can focus on the care. We can focus on the client relationships and focus on our staff. In staffing, industrial staffing, there tends to be a lot of numbers. You need bodies in places. For us, our customer is the clients that pay us for the help and our staff, because if we don't have them, we don't have a business.
Right.
And right now in healthcare, there's shortages everywhere.
Right.
So we needed to take our eye off of the administrative minutia and put it on the things that mattered most.
Well, spend your time doing what you do well.
Yes, exactly. Right. Not typing
Right.
faxed time cards into a system that has
On a typewriter,
Yes.
click, click. What is happening?
yeah.
So did you bring this idea to your mom and say, I think I could make things run a little smoother?
Yes. Yeah.
And was she
And she
resistant,
said,
accepting?
yeah, she said, well, go ahead and do it. And so I met with the woman who developed the database that was the foundation of their timekeeping and scheduling system. And I talked to her and I'm like, we need to have mobile. It needs to be in the cloud. We need agility because we can't keep doing this. And she's like, I don't think that's what we need to do. And I said, well, it's what we need to do. So we ended up changing
I was
systems.
going to say then,
yeah.
unfortunately, you may not be the right
Right.
provider.
It wasn't a good fit anymore. And they had a long-term relationship. And that's why I started there.
Yeah.
Like,
Right.
let's work together to do this. But these are the things that I've seen and I know work really well. And we did a lot of research and had a lot of presentations. And, you're vetting a system that's going to be the backbone of your business. And we ended up going with a system that was built for home care, which was brilliant on the home care side of the business, but not as great a fit on the business to business side. So we kept that for 4 years, I think, and we've since iterated again, and this is even more agile. And this allows our clients to go into the client portal and put their needs in, and our staff to get a notice and pick them up right away. So again, we've taken all of the administrative work out of that part of it and created so much flexibility on both sides.
That's
and it's
amazing.
really been amazing.
And technology is changing so quickly.
So quickly.
Yeah, so you're open to adapting anything new and
I'm a bit of a change junkie.
yeah. I love it.
It's not always a good thing.
So, for us, part of the reason we started this is because we were navigating our aging parents. And how did you realize that families just don't know how to navigate the system?
I think the thing that was like whoa for me was I didn't know that in-home care and home health care and private duty care in the home are all three distinctly different things.
Right.
And when I was working there and learning the business and took a call and I said, yes, we do home health care. And the record scratched and everybody in the office like, no, we don't do home health care. And so I realized because somebody was calling but they didn't know what
They didn't know what
kind
they
of
were asking
care
for.
they needed.
Right. They just knew that somebody was in their house.
Right. They needed help for a loved one, but they didn't know if that loved one, if it would be a doctor's order, and so it would be paid for by Medicare, which is home health. They didn't know if they needed medical care, which is
Right.
private duty or nursing care, or if they needed a caregiver, which is in-home care.
Right.
There's subtle differences. in
Assistance
the
with daily
titles.
living.
Yes, exactly. Exactly. So the questions were coming into me, and I realized I didn't know the answers because I didn't understand the subtleties, and that was the big aha. Like,
Right.
wow.
And I'm sure even it may start with a caregiver,
Sure.
but it may change over time, the needs of that
Absolutely.
family.
Absolutely.
For obvious reasons. So people love to say they want to age in place. And we hear it all the time. We have and sometimes that's a great fit. But what does a realistic plan look like and how does that work?
The best way to describe it is actually my parents. My parents are in their 70s, and my mom was in this business for many years, and so she knows the ins and outs. And she and my father live in a ranch home, but there are 5 steps to get into the home. So 10 years ago, they had a ramp built to their front door so that if one of them had a fall or was confined to a wheelchair, with a walker or wheelchair, they could get up to the house, because they couldn't get in the garage because there are steps there, couldn't get in the front door.
So great, you're living on one level,
but you
gotta
can't
get there.
into the house.
Yeah.
Exactly. So then they got an estimate and decided to renovate their bathroom because they had a step-in tub, and now they just have a walk-in shower with a teak bench in there, and it's lovely. And they put
Grab bars.
They have grab bars, but they also put like a heater under the floor and the tiles that are grippy.
Yeah.
And all of these things.
So what does that mean, grippy tile?
Well,
there's a certain kind of tiles you use in the shower?
No,
Tell me about
when they
this.
step out, it's not like a gloss.
Right.
It's just more of a
Matte finish.
matte finish with a little bit of texture,
Okay.
so that they're less likely to slip when they step out.
I was like, is this some new
So they
what are
were
we talking about?
I'm not. I wish
They were
there was.
proactive though, because they didn't have an injury or
Nope.
something that made them say, let's do this. Your mother, just because she had this background, was thinking
Saying
ahead.
we can't, if we want to stay here,
Right.
we can't do it unless we make some changes.
But that's an exception to the rule, wouldn't you say?
Absolutely.
I mean, most
Absolutely.
people are like, oh my goodness, my mother fell, is in the hospital, went to rehab. They're going to be coming home.
I don't
Holy
know if
moly, what do
home
we
is
do?
Safe. I don't know how to get them up to their
Yes.
bedroom, or
Yeah.
Right.
the only full bathroom is on the 2nd floor, that kind of thing.
Kids
Yeah.
are working, have their own family. They're trying to figure out how we can get all this done
Right.
to get mom home.
Yeah.
And that's when
And
they
that's
call you.
usually the crisis.
and they
That's
call
the
you
Yes.
and say, I need help, right?
And
So your mom knew, so she planned early because
Right.
she has the experience. But when is the right time to start planning?
right time to start planning is now.
Right.
You and I are within a decade of one another in age,
Right.
and not thinking about losing our independence ever.
Right.
That's right. It's never going to happen
It's
to me.
never
You're
gonna
exactly
happen,
right.
ever.
Right.
That's because that's the way we want to be.
Sure.
But now is the right time. You guys are in a great position because you're building a network of individuals who have services or products or knowledge that can help you if
Yes.
something were to happen. But a lot of people just wait until crisis
Right.
rather than actually seeking out resources before they need them.
Right.
One of the really nice things, and this kind of it tweaks me a little bit because I'm old enough to belong to the senior center in my community. And we support them. Our organization supports some of their activities. And I go there and I think, how can I be a member?
Exactly. I'm looking at you
Okay,
going, what?
First of all, she has the most magical silver curls you've
Yes.
ever seen in your life.
Everybody tells you
But
that.
she looks like she's 35.
Yeah.
So I don't know how she's a member of the senior
I
community.
know.
But go ahead, Leslie.
Well, thank you. Yeah, but honestly, I've been thinking lately, maybe I should go play mahjong or something occasionally, or go to a play or something to start to build a relationship. Even though I'm in the business, it's like this is how it starts.
Right.
You do things just a little bit differently over time. I think what we do so much is we're afraid of becoming our parents
Right.
or our old aunt or the people that you see in the senior center that are honestly still very vibrant.
Well, that's what I was going to ask you. When you walk into the senior center, are they looking at you like, why are you here?
No.
They're not?
No,
They
it's
think like you're somebody's daughter?
They're like, who's that cool chick that just walked in?
no, it's like there's a lot going on there. Like, oh, maybe she's here to play bridge today, or something like that. There's in their minds, it's enriching, and they're looking for opportunities to stay social, stay active, and
that is very important.
It's very important. Thinking about the staying social aspect, super important as we age. It's even more important if we live alone. Those of us that are, have a partner, we can count on each other. Right. But when you get a lot of women lose their husbands before they're ready, and they're alone. They need to stay social because
need
that
a sense
really
of community.
Definitely.
That's one of those blue zone things.
Yes, exactly.
I was thinking the same thing. And if you haven't seen that, you need to watch it.
Oh yeah, and there's a book. Good stuff.
So, what are the red flags families tend to dismiss that signal it's time to bring in help? It's time.
It really differs because there's so many things. Their cognitive decline is very common. But that looks different for different people. Sometimes it's forgetting something simple. Sometimes it is starting to lose track of the dates and times that you have plans. But there's also things like Parkinson's. And if you're not familiar with Parkinson's, that whole body freezing thing is an indication that there may be something advancing. And like somebody stops moving and their muscles freeze, and that's a symptom. Well, if you don't know anything about that, so it really, it depends, except there are things like the daily activities. If your loved one can normally take care of paying their bills, take care of showering and grocery shopping, or at least if somebody brings in groceries, they can feed themselves. But you're seeing that they're losing weight, that the bills are sitting on the table and they're not being tended to. Hygiene is another one. I'm sure you've heard this before.
Yes.
That's a big indicator. But some of these things are pretty subtle. And older adults that are afraid of losing their independence are really good at hiding things.
Yes.
My grandmother did not want to stop driving, and she had macular degeneration. And she drove a white car, and she had an accident. It was minor. And my mother and her siblings said, I think we should talk about, it might be time to give up your license. And she said, absolutely not. It was minor, so they let that alone. And then she had another scrape. And
I like how you say scrape.
She knew what was coming.
Right.
So she painted the scrape with white house paint that she had.
Oh, no. Like, nobody's going to notice.
Nobody's going to notice. Yes. And so it's those types of things where you, especially if there's some sneaky behavior, you got to make sure that you're having those difficult conversations.
And how do you start those? Or do people come to you and say, we need your help in starting it because my grandmother is in denial?
Resisting.
Yes.
Yeah, it's very common. And I think you talk to the children or somebody, the loved one, about, don't feel guilty, because you are starting this conversation from a place of love, from a place of caring. First of all, if you're feeling guilty, give yourself some grace. And secondly, bringing in a third party is very helpful, because someone like me, I could come in and say, tell me what's good, tell me what's not good, and not have to be, you can't drive anymore.
Right.
It's easing in.
Yeah.
And then we can come back with, advice.
I love what you said, though, about like the children not feeling guilty, because I think that is really a big part of things. and you know that you need to start this process, but
Yes.
It feels terrible.
Yeah.
And I think it's important too that we don't always take on the expectations of what that parent might have of you.
Yes.
And we have to set those
Oh my
boundaries.
gosh.
Because sometimes their expectations are not realistic for
No.
your life, for
No.
your family.
Right.
And I do believe that your immediate family, your children, your spouse have to be your number one priority.
Right.
Not that you're not going to take care of that aging parent, but your marriage, your children cannot suffer as a result of that. So some of those expectations of that parent have to be tempered.
Yes. Yes.
I
exactly.
say that from experience.
And it's so hard. It's so hard. And that's really the long and short of it is it's challenging for everybody.
Right.
Everybody remembers what it was like to be in their 20s, but you're not in your 20s anymore.
Right.
Everybody remembers what it was like to be independent in your 60s once you're in your 80s, but you're not in your 60s anymore. And it's
Right.
that continuum that challenges us so much to be willing to step into the next chapter. And that's really, give up the guilt, acknowledge that as a caregiver, a daughter, a mother, a wife, you can't be everything to everyone. And
Right.
women, I think, in general, tend to overcommit and undercare
Absolutely.
for themselves.
Absolutely. So let's talk about, we're talking about the family and the individual. Let's talk about caregivers for a minute, professional caregivers. And who tends to thrive in that field? And how do you find them?
Right. It's our best employees are people who really need flexibility in their professional lives. They need to work, but they may have young kids, or they have an aging parent, or they have both. We have one nurse who has a child who has disabilities, and so has to be able to work not when that child has immediate needs. And our flexible schedule, our employees work when it works for them. We do have some people that work, some school nurses that will work the whole school year and then work summer school and summer camps. So they can work year round, but some that work just the school year, and some that work maybe 8 days a month because they don't need to work more than that. Retired nurses, they don't want to work full time and be on somebody else's schedule, but they don't want to stop nursing.
Sure.
And CNAs, our certified nursing assistants, we're a second job for many people that are certified nurses assistants, and these are the backbone of our entire healthcare system. And they work full-time in a hospital or a long-term care facility, and then they work part-time for us. Or they'll take short shifts for us sometimes if we have just visits or baths.
So a CNA, what are they able to do as opposed to someone who might not be a CNA?
A caregiver. A CNA has medical training, so they can work with someone if there's a doctor's orders for different exercises. A CNA can do that safely. They're trained to do assists in moving. A lot of times, if you have somebody who has limited mobility and you have a caregiver who doesn't have training to help them get up safely and get moved and sit down again safely, you've got a caregiver who has an injury. CNAs can do med reminders. We train on dementia, so look for signs of dementia and there are amazing caregivers, but caregivers are, their training is about 8 hours, I think, most of the time. So they can
limited.
learn what their individuals need, their individual clients or patients need. But across the continuum, CNAs just have a deeper knowledge of how to safely take care of people who have medical limitations.
And then is CNA different from a medical, like if somebody needed medical attention, or are they considered your medical?
Well,
Because then you have nurses.
then we have
Nurses.
nurses. We
Okay.
have
So if there's
licensed-
wound care,
That's an RN.
then
Okay.
Licensed practical nurses can do wound care as well.
And you provide that too, right?
yes,
Which not
yes.
all companies have that.
No.
I mean, I think that's rare that your company does have that.
It is.
right?
It is different than
Than
a
just-
lot of the caregiving companies.
Yes.
They really just have caregivers,
Right.
and we partner with caregiving companies because if somebody calls us and really needs help with their ADLs, their activities of daily living, we don't need to provide a certified nurse's
No.
assistant to do that. We can refer a caregiving company and say they've got the perfect people to be that companion for your loved one. So
I love it.
yeah.
awesome.
All right, we have a lightning round.
Okay.
All right.
All right, in the morning, coffee or tea?
Coffee.
Early bird or night owl?
I'm early.
Me too.
I
Okay.
want to be a night owl, but I'm
One phrase you hear all the time from families after they get help.
I would say that it's such a relief. It's such a relief. Yeah.
Okay, I'm going to go off script. Favorite curly hair product?
She's obsessed with her hair.
Well, I have a lot of favorites. It depends on the season. You know, I have
Oh,
to change
see?
my product with the
There
season.
you go.
Okay, winter.
Winter, I actually got a gift over the holidays. It's a Bumble and Bumble product, and it's a curl activator, but it's got a little bit of like an oil in it, so it keeps it
Keeps the
soft.
moisturizer.
Yeah,
Okay.
moist.
Summer.
Summer, my favorite product is a Canadian product. The company is called Love Yourself, so it's LUS, and they have shampoo, conditioner, and curls based on if you have curly, coily.
Oh, you got all the numbers, right?
Yes, exactly.
Okay, one more question we're talking about. I'm sorry, you can't, if you've got to watch this on YouTube so you can see this hair. Okay, how do you keep it so silver? Because I know there's an art to that. Do you use a product to brighten it?
I do. There is a product now. It's Fanola. It's a purple
Right?
product, and it's a tint from Italy. It's like purple shampoo, but it's actually not a shampoo. It's just a tint. I use it when I put my conditioner on, and I use it
Nice.
once or twice a week.
So there you go. You got all your hair tips from someone with fabulous hair.
Thank you.
And if you have silver hair and you're a senior listening to us, this was important. Or if you have curly hair.
Well, Leslie, thank you so much for coming on. I think you gave everybody so much great information. We will have all of your contact info in our show notes,
Wonderful.
and we'll link it to our website.
And we're so glad you joined us again for another episode of Help, Nobody Told Me.